You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back to the show, Health Innovators. On today's episode, I'm sitting down with Patrick Tarnowski, who is the founder of PTx2 Healthcare Consulting. Welcome to the show, Pat.
Thanks, Dr. Roxy. It's a pleasure to be here. I'm looking forward to this conversation.
I'm so glad to have you here. You bring a very unique experience to this conversation. We have healthcare leaders that have been on the show, and we have advisors and consultants, but not, I think, no one that is well versed in the healthcare leadership ecosystem that has now become a consultant. And so then to be able to bridge those insights, I think is just going to make for a very powerful conversation today.
Yeah, I think so as well. I've been so fortunate to be able to really live and work for 30 years in every part of the healthcare ecosystem, like you mentioned. So I'm looking forward to the conversation.
So let's go there. Tell our audience a little bit about your background and experience, and then, what you're working on these days.
Yeah, fantastic. So, I started off in the provider space. So I'm a physical therapist and really loved what we're doing with our patients. Did that for about 10 years and did a lot of teaching, both continuing ed and academic appointments at a few universities. Absolutely loved it, but just got a bit pooped with the day-to-day patient care, and really realized that I still want to stay involved, and found a bit of a penchant for the business of our business. So I took a bit of a left turn at that time in the healthcare career and did an MBA and moved into medical devices and spent 7 years there working with one of the largest medical device companies at that time. Then it was pretty exclusive to orthopedic surgery and rehabilitation. And younger company, we were private. We were taken, public. We were taken private by a large private equity firm. So it was my first exposure into what private equity looks like. The good, the bad, and the ugly with it, but mostly good. Yeah. And in that experience, got to touch an awful lot of parts of the organization, whether it was from quality to sales to marketing to product development and research, working with our national accounts, payers, doing advocacy work in Washington, D.C. and at a state level, and absolutely loved it. It couldn't have been a better learning lab for the time and doing an MBA as well.
Right.
But I was traveling a bunch. My kids were young and it just didn't make sense to stay on the road. So I was fortunate enough to be a co-founder of a occupational medicine practice here in the Twin Cities. And we had great success. We scaled quickly and exited from there. And again, was invited to join one of the largest health systems here in Minnesota to lead. This is really in the early days of the development of clinical service lines. So the dyad leadership model with physicians. And I was fortunate enough to be able to work with an incredible team of leaders, physicians, administrators that were really dedicated to this concept of how do we create an exceptional experience that is consistent, that is affordable, evidence-based across multiple providers and multiple geographies. And we had really, really good success with that. So it was just an amazing opportunity.
So the early stages of centers of excellence, huh?
Yeah, conceptually like that. And then how do we take what's at the core of a center of excellence and scale that into multiple geographies? And some of the really, I think, kind of unique challenges to that. There's certainly the administrative side that says we can get system advantages and some of the economies of scale, but what became really interesting and informed an awful lot of the work I'm doing today was branching into the more rural communities and understanding the unique and important position that rural providers and rural hospitals have in their communities. Unlike what we see in some of the more urban environments, where there may be multiple systems, multiple hospitals. When you get into a more rural community, that hospital and that clinic and that small nursing home are really the fabric of that community. And so we realized that we could bring out here's sort of the package for clinical consistency and such in a clinical service line, but it didn't always fit. Maybe 80% of that would fit, but 20%, we need to respect that, which makes, that clinic, that hospital unique to that community. And that was a great learning and great opportunity. So after that, I spent a few years with a venture group spinning up one of their portfolio companies dedicated to musculoskeletal care, which is certainly a very hot segment and expensive segment. And then multiple years with another health plan where I was fortunate enough to lead a digital health portfolio. All of the products that we would choose to bring in, that we would then bring to our self-insured and sometimes the fully insured and sometimes the government markets. And it was just an amazing time at the explosion of all of this digital care to be on the buyer side of that and understand the things that are really important, not only to the health plan, but also to the employer partners that we have and ultimately to our members.
What years were that?
That would have been, starting in about 2017 up until about a year ago.
Yep.
And so really, as I said, the explosion of the digital health and then layering on a pandemic where not only did the number of technologies coming to market increase, but so too did the adoption. And so from the health plan, there was really some unique opportunities and unique challenges there as well. How do we vet these for safety and security? How are they going to fit into a provider community? How will they fly with our members? How now that our most of the employers are remote, there's both opportunity and challenges there.
Definitely.
So all of those things were very formative, and left there about a year ago, and began getting calls from founders saying, "Boy, you've been in these the whole ecosystem. Most recently, as I mentioned, you were a buyer at a health plan, and we would love to work into a health plan. We would love to work with employers. Can you help us understand how this works, how they think?" Yeah. And what I have so enjoyed is working with founders, whether they're early in their career or this is their second or third founding, who see the opportunity for disruption in healthcare and the opportunity for improving care delivery, but they just might not understand the sort of underbelly of how healthcare works or doesn't work, or the complexities of it. So being able to help advise, inform, guide, and do an awful lot of customer discovery has been such a pleasure.
That is remarkable. So is there anything that you haven't done? And how many careers have you had in one lifetime?
Yeah, let's say all of them. All of them. Right.
Oh, yeah. And you're not just nationally based, you're doing some work globally as well.
Correct. Yeah. I've been fortunate enough to work with clients from the Middle East, from the UK, from Canada, who have, again, unique needs. Exceptionally smart people, great technologies, who are, what I have appreciated about all of them is they're willing to say, I don't quite understand the US market. Mm-hmm. And I'm not so enamored with my technology that I'm forgetting about the workflow with providers or the experience of the end user, the member, the patient,
where are
whatever you
those
want to call
people?
it. Yeah. Those people. Yeah, we have to remember them. So I've really appreciated working with folks who are open to those kinds of conversations and realize that they don't know when they need some help understanding it.
Sure. Yeah.
Mm-hmm.
So then let's go back to the lens of you being on the other side. It's really not that long ago that you were on the buyer side, right. And at least I think half of our audience here is trying to sell into a provider market or a hospital system or a health plan. So what are some of the challenges or opportunities that you would want to share with the community today?
Yeah, that's such an important question. The opportunities are great in that when we look at the spend in healthcare, it continues to go up. We have pockets of whether it's disease management or experiences, pockets in the different geographies where there's been good success, but in aggregate, we still see that there's great opportunity to change the way care is delivered, to reduce costs and improve quality. So while there's great opportunity in a lot of lives that we simply can't touch today, I mentioned the rural health markets before. We look at just whether it's socially or economically disadvantaged communities who we're just not serving well. There's amazing opportunity there. I think the pandemic, and I've heard so many times other experts on this on your show talk about how the pandemic sort of pulled back the curtain and said, "Boy, there's opportunity here for digital care." So we see all of these I think avenues for growth and avenue for accessing and bringing more care, different care, virtual care to different lives. Some of the challenges, though, that I think I've been able to share with many of the clients that I'm working with and these founders is, one, let's just understand it's a long sales cycle. And I think folks hear that, but we'd say, I know I can save money. I've done my pilot work, and I've got a few clinical studies that show that it has an impact. And while someone comes into a payer with that data, we'd say, well, that's great, but we need to validate that with our own data. So that slows things down. We need to understand how does it fit? Because as I mentioned, I had a full portfolio of products, and bringing something new into that, I need to understand how would it complement or potentially collide with something that I currently have. And for me, if there's a opportunity for it to be additive, I still need to be thinking, the sales cycle is so long, I need to be thinking for the next 2.5 years. So by the time I've made my decision, I'm selling for probably 2 years ahead. So those are some of the things that I think have been interesting for these founders.
When you say selling 2 years ahead, you're not talking about as the founder, you're talking about as the buyer. So as the buyer, you made the decision that you're going to buy, and it's still going to take you 2.5 years, 2 to 2.5 years to sell. So do you mean like selling the other leaders within the company, the other departments?
No. Yeah, that's important distinction. So yes, there's as with enterprise sale, it's how do we align and create, find the resources internally and get those levels of approval. But when we look at if so much of the market that we're bringing these solutions to is the self-insured employer, let's say, because the health plans in that case are acting essentially as a reseller, even though there may be provider contracts or however the reimbursement is working. We're recording this in November, so all of 2021 is sold. It's in the can, it's in the books. And for many of the large employers, the national accounts, jumbos, whatever terminology we want to use, those decisions are typically made in February or March,
right?
For the next calendar year. And that means I, as a buyer, need to have had contracting done and filings into state plans by probably August of the previous year, which means I probably started this RFP and review and negotiations even the year before that. So that's some of the complexity. And I think when we start talking about that with founders who'd say, I've got my seed money, I've maybe, I've raised some dollars, and we'd say, boy, it's gonna take you a couple of years to probably get a first client. Now there are some health plans that will say, yep, I need it, I want it, you're filling a huge need and let's go fast. But for the majority, it's a slower process. And I think some of the founders are saying, oof, I didn't know that. So I need to better understand that. And maybe there are some other avenues that we can take along the way to show adoption that would make investors happy.
And I think just even the term fast is really relative. It's very subjective, right?
Right.
Their perception of fast, I need this now, is very different. I think probably, than a lot of these startup inventors and entrepreneurs.
Yeah.
So some of the challenge is the funding, right? So is it a different conversation with those investors? Is it a different type of pitch deck to set the expectations of the amount of resources that are really needed to be able to build a company around this new idea? Because you're going to need resources for so long. How are they getting investors to support that? Oh yeah, you're not going to have cash flow for 3 years.
Yeah, I believe what I'm seeing, what I advise is just that. Let's be very upfront with the investors.
Yep.
And I know and I'm not, that's not an area of great expertise for me. So there may be some others that will counter this and say, no, here's the better path. But I've always been a believer in saying, and just being very, very transparent with whomever is investing, that we've got an idea, we've validated it, we're working through these processes. If our channel is with an employer, with a health plan, and then ultimately to the employer, it's going to take us time to get there. So I think being upfront with that, it seems to me, I just always deferred to the let's be realistic and honest about it. So, otherwise I think we have investors coming back to founders and just being very upset and, dissatisfied. And that leads to more tension within the organization. And perhaps those organizations are making poor decisions as a result.
Yeah. And great ideas in the zombie graveyard.
Yeah.
Not because it was terrible technology. Yeah.
Yes. Yeah.
So, as you are working with innovators who are figuring out their business model, is there a particular payer, and I don't mean it like a managed care organization, but is there a particular payer where you're saying that if you can figure out a business model for this target market, you're going to be better suited than trying to sell into this, because, you've just saved yourself 18 months of sales cycle here. Is there any learnings around that might be useful for the community?
Yeah. I think there are. And there's probably a few different ways to look at that. Yes, understanding the unique needs of a payer, because once you've sort of made inroads or made connections or understand one payer, you have understood one payer. Yep. Everybody has their unique needs. And so understanding what their drivers are, what are their key initiatives, how are you fitting into DEI initiatives or whatever, whatever those are, and what needs do they have. So that's one piece of it. The other piece that I think has to happen before that is for these founders to really understand their product and what, not only from a tech perspective and care delivery perspective, but what problem are you solving? Mm-hmm. Because and sort of my mantra has always been, I'll take the call. If someone wants to talk to me, when I was either the buyer or today, I'll always talk with them and let's just see, and being very honest on, hey, this makes sense, or you're not ready yet because of this. Yep. And oftentimes what I discovered was that they weren't ready because they didn't quite understand the problem. They hadn't done the homework. They hadn't done the discovery work to talk to the potential buyers, the customers, and not even sell their product. Don't go in to sell. Go in to say, I have a hypothesis. Help me understand if I got it right or wrong. Tell me about your day to day. In fact, we were just doing that this morning with a client. It's got a really impressive idea around senior preventive care. Fascinating, and if they can, I believe if they can find the right clients or the right buyer, they will have great success in reducing hospitalizations. But yesterday we were talking with a buyer and administrator in a certain segment who said, I'm not sure you're going to like what I'm going to tell you. And we say in Minnesota, it's sort of a Minnesota nice thing, right? And we said, no, feel free to tell us that the baby is not the best looking one here. Tell us so we can avoid mistakes. And then today we spoke with a physician in a different part of the country who said, I think people like me would be all over this. We would love this. So it's that sort of thing. But what we're learning in this discovery is not just walking in with I can fix it all, but I understand you. I understand you. I understand your problem. I understand where I can fit, and I understand the real challenges that you have. So I think that's an important piece to be more successful in targeting the health plans, is coming in with a really focused, and you understand not only your business model, your finances, your technology, but you understand the solution and what problem that solution is solving.
Yeah. And obviously that's very critical, really, no matter what market segment you're wanting to.
Yeah, that's not a new concept, but it's surprising to me how we tend to forget that too often.
Yeah. I think there ends up being a lot of ego and a lot of biases that are woven in to the fabric of this initiative that become really just difficult, just a lot of emotional investment in the idea, in the technology, in the pathway, and that gets really difficult to kind of unravel. Um, and I also find that founders really want to move fast. And so there's this perception and the reality that customer discovery, slows things down.
Yeah, and it could, but it doesn't have to. You can do a very rapid customer discovery, and the process that I use is really based on. I was fortunate enough a few years ago to be part of the National Science Foundation in their I-Corps program, and I know many of the folks that listen to your show have referenced that. And the old adage there is get out of the building, go talk to people, and it is so much fun to talk with folks from all over the country. And we're not, we'd say we're not here to sell anything. We're just here to pick your brain.
Yeah.
Talk about you, talk about your environment, talk about what keeps you up at night. And, if you were on the other side of this conversation, what do you think would be really important for us to know?
Yeah.
So that can move really quickly. Versus some of the more traditional, expensive 12-month, let's go explore a market. I think you can do those things very quickly and with a get meaningful information from a relatively small sample size.
Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit. So let's talk about that. I want to kind of dig in the weeds a little bit because I think that's such a valuable conversation. So let's say we've convinced folks that you need to do customer discovery. So some of the roadblocks that I have witnessed and have heard about is recruiting. Depending on who they're trying to get to sit down and give them 20 minutes of their time. A lot of times it's more of these SVPs or the C-suite that they're selling to, maybe, or physician providers that are going to be the users in this. And so getting access or recruiting them for those one-on-one conversations or, those face-to-face encounters is really a challenge. So what are some of your recommendations for being able to overcome some of that?
Well, I would challenge the assumption that the right level of discovery is the C-suite.
Okay. Yep.
Because let's envision that we're found. Well, we are founders, but let's envision we've got a product today, and it will solve this particular problem in healthcare. If we go to the C-suite, that population has 8,000 things on their plate right now that they're thinking about, worrying about, future state, current state, all of those areas that are inherent to that position. Are they going to be the users of the product? Will they be able to really help you solve and understand the day-to-day ecosystem? And oftentimes not. I mean, they just might not be connected to that frontline work that needs to be done. So going to that level, to me, that almost feels more like a sale than it does a discovery. So if we can get to a frontline, and this part of the discovery is, who is the buyer? We start with, we think it's this. And another adage from the National Science Foundation is, buildings don't buy products.
Right.
People
Logos don't either, right?
Yeah, right. It's nice to put a logo on your site, your website, and say that they're a customer, but the logo isn't buying. It's a person. So who is that person? What is their title? And then understand what's important to them. If you figure that out, oftentimes in part of that discovery, they will say, oh yeah, I mean, if you're on, and someone says their eyes light up and say, I'm buying today. Good. Who do I need to talk to now?
Right.
Well, let me walk this down the hall to so-and-so. So, I think that, just challenge the assumption that we need to start at the C-suite or with the key opinion leaders because they get the pitches all the time. And I'm not sure that founders would necessarily learn what they need to at that level.
Yeah. Yeah. I think that's a really valid point. The other one that I hear a lot about is compensation. So am I, expecting folks to be able to have these conversations for free? What kind of budget do I need to have allocated for this? Sample size, how many people do I need to have these conversations with until I get some kind of statistical significant learnings that I can kind of make informed decisions on?
Yeah. Sample size, generally the more the better, right? Because if you talk with 10 people, you're probably going to get, unless you are so totally dialed in, you're going to get 8 different responses.
Yeah.
Which at that point, you may have just figured out the discovery process. You might have figured out, oh, we're asking the wrong question. So more is better, but not everybody can afford more. Sure. In my experience in this discovery process, we're asking people for 15 minutes. This isn't a sit down, give me 2 hours. Right. So and I think as we become a much more virtual society, it's okay. Back in pre-pandemic, pre-virtual, ideally it was great to sit down face to face with you. And so there's travel expenses and all of those sorts of things. Yep. But now we can do it here. We can do it when someone's sitting in their car. It's good to have a face or face to face, at least virtually, because then we can watch your pupils, and say, wow, you're onto something. Or we see the nonverbals that give you the, right. I don't know where you're going with this, but we can say just that. Yeah. I see that this, this doesn't seem to resonate. So I think from a budget perspective, it's more about, it's the time to do it, but to find 15 minutes with folks, I've just found people to be very, very willing to talk for 15 minutes. Yeah. And you can learn a lot in 15 minutes with somebody if you're targeted in the questions and, it's not rambling, just be very respectful of their time.
Yeah, I completely agree. I think that it's worth it. It's their entire business is really reliant upon the foundation. Right. Yes. These decisions that are being made based upon so many different assumptions. And so if it takes you an extra $10,000, if it takes you an extra 60 days to actually have some validated assumptions or validated hypotheses that then you're building all of your other resources around. Right. I mean, that's just a no-brainer.
Yeah, that seems like it's the ounce of prevention, concept. Yeah. And I was just, even this morning, I was talking with a founder and his co-founder, potential we could do some work together, but we spoke 3 weeks ago, just an intro call. And as they were explaining what they were trying to do, they could see my nonverbals because I did give them the eyebrow went up, and and I started to sit back from the screen, and we chatted again today, and they said, here's what we've learned, because I'd given just a couple of suggestions, and they said today, here's what we've learned. We've gone from a boil the ocean strategy to this. And it at least on the surface, looks to be elegant and solving a big problem. Yeah. So it was just so exciting to see folks take that on. And what did it cost them? 3 weeks and 20 phone calls and probably 50 hours of reading.
Yeah. And I want to have a conversation around that, boil the ocean. I think that's another challenge that so many founders are facing when they really are onto something. Like, it's very common that there is a problem that's pervasive, and maybe it's other markets besides healthcare, or maybe it's just many sectors within healthcare that they could sell to, or many variations of that product. And sometimes, I think they're just thinking that bigger is better. And so if I'm, oh, I've got 10 markets and 3 products, like that's so much better than 1 market and 1 product. And, it's not to say that you can't have that big grand vision, but you got to start somewhere. Right. And I think it's very often alarming when someone's trying to boil the ocean.
Yeah. It's really attractive when, how many times have you heard from people, the TAM, the total addressable market is, billions of dollars. And if we can just get 2% of that, we're going to be great.
Exactly.
And
it's like,
and you're right. Your math is right. But let's talk about what would it actually take to get there? And well, what if it's half of that? And I think there's great value in narrowing it down. Let's prove our concept. Let's prove our technology. Let's prove the value, however we define value, whether it's an improvement in cost or safety or security or engagement, whatever it would be. Let's demonstrate that there's value. And that becomes I think that's a story that would resonate with me as a buyer much more than I can fix all of your problems. So let's come in with a target, and that actually lends itself to, and there's the old adage, the death by pilot, and the number of pilots that we do, but I believe there are willing providers, there are willing health plans, there are willing health systems to pilot something, and it's a lot easier when it's very targeted, because then we can identify the patient population or the member population or the employee population, however we're segmenting those groups. And not only identify them, but start to see, did we make a difference pre and post?
Yeah.
And if there's a difference, odds are that's going to lead to something bigger and better.
Definitely. And I think the positioning and the messaging is so much easier when you're very narrowly focused, right? You can really have a much stronger value proposition and positioning strategy than if you're trying to, maybe be all things to all people.
Right. Yeah. I recently worked with a client that when we started some of this discovery and some other activity, we kind of heard, so I don't really get what it is that you do. and then that has changed over the course of a couple of weeks to, oh yeah, that makes a lot of sense. So it's the refining. And again, I think it's the slow down to go fast kind of thing. Let's learn quickly. But from there, it's not just learning, but now it's the application. We talk about that with patient care all of the time. We don't necessarily need more information as healthcare consumers. We have all sorts of ability to gain information. It's now, how do I activate? How do I use that information in a meaningful way? And that's, the founders need to apply that to their own businesses. They need to apply that as we look at, well, this is information that's going to be meaningful to the providers. This will really change the provider's world. And when we actually sit with leaders or frontline providers, they say, I'm so overwhelmed. I don't know how this information, how to use it. It's not necessarily actionable. It doesn't fit into my workflow. And I'm so busy today, I don't quite know how to apply those. So, those are just the things that I think are so important for the founders to spend a bit of time learning and understanding.
Yeah. Yeah. And going into it with the mindset to seek understanding as opposed to validate what they already believe, right? Like I'm on a mission to learn something new instead of I'm on a mission to confirm that all my ideas are correct.
Right. And so, we've seen over the years those kinds of discovery sessions where when a customer is saying, no, it's this and this, and you see a founder say, yeah, but no, but I think you got it. No, I don't think you're getting it. I don't think, and so they're really trying to sell. And you just want to do the, hey, time out. Listen, this is what they're telling. It's okay. This is what you need to hear.
Yeah.
But that's hard. It's really hard when you have put so much of yourself, physically, emotionally, spiritually, financially into this, and then someone says you don't have it quite right. That's really, really hard to hear. And unless you take a very, the approach you just mentioned, I'm here to learn.
Yeah. Yeah. And I don't think that we can talk about that enough when it comes to entrepreneurs. Is just shouting this from the rooftops, because the sooner they like acquiesce to this strategy and this process, the sooner that they will be on their path to profit versus I'm going to ignore that. I'm going to, launch into the marketplace. I've got a $500,000 or $1 million invested, or maybe even more. And I'm 2 or 3 years in. I kind of had some false positives with a few customers that bought. So it felt like I'm on the right track. And now all of a sudden I lost all my traction. And I'm stuck and I can't really grow. What's happening here? And it's just because the whole house is built on the wrong foundation.
I think there's a lot of truth to that. And it might not even be the wrong foundation. It just might be that it's the right foundation, but it's just not executed correctly.
True. Very true.
Yeah. And I continue to be impressed by how amazingly smart, passionate, committed so many founders are, and how frankly courageous they are to say, we're going to go do this.
I'm going to change the world.
That's right. It's a big leap. And I so appreciate their energy along the way. It might not be that the idea is completely wrong. It just might be that it's not executed right. But it might be that the idea is really wrong too. And let's learn that faster before there's a catastrophic mistake.
And you know what? I think sometimes the mindset is that, I don't know if I want to say something's wrong with me, but like something's wrong with me if I don't already have the answers. Something's wrong with me if I don't just know what path I need to go. Or even thinking that this is like a startup issue. I mean, it really isn't. I mean, no matter what size company you are, no matter where you are in the product life cycle or in the company life cycle, there's a book I read called Experimentation, and it's just endless stories of even companies like Microsoft who experiment and they change and they tweak and they conversate and all of these little things. And I mean, the change of one button, was like $10 million, so it's not something that just entrepreneurs have to do. It's just smart business for anyone today.
Yeah, absolutely. And you raised a point earlier on with it can be hard to do. And I think especially in the founder space, and there was someone on your show recently who was talking about, we see these companies that were founded today, and then in 3 years, their valuation is $1 gazillion and such. But she made such an important point when she said, no, we started our company 10 years ago. Right. And it wasn't really until we incorporated this way or became our S Corp or whatever it is, that's sort of like the official on paper date. But what we tend to forget is there's been a long lead up to that point. And so, I think that the founders oftentimes who just feel that they feel a bit exhausted, or they feel that there must be something that I'm doing wrong, or I'm not getting the traction that I want. That's real. And I think they can get stuck sometimes by seeing these sometimes rocket ships that we might not hear the whole story there. The full backstory.
Well, I think that's a big role that this show plays in the
I would agree.
Is for those folks that want to be honest and candid to come on here and really be transparent about the realities of it. Not because we want to be negative Nancy and doomsday here, but we just want to be real. So that way other folks are encouraged and not thinking that, I just need to go A, B, C and eureka, because it's just not realistic.
Right. Yeah. And I think, you founded and done your own thing, and that it's never linear, right? It's not A to J, it's A to wherever, it's A to Pluto and back. We're all over the place. And the same boat here. I'm learning every day, not only from my clients and from customers, but I'm learning every day about how to be a better founder, how to run a business differently. I've got such a amazingly supportive group of peers that we can sit down and share stories with. There's great readings, podcasts like this that are just filled with information about maybe not necessarily the how to, but here are mistakes. Here's learnings along the way, and let's share those.
Yeah, and let's just, encourage each other. It's some
Yeah.
wisdom, but also some inspiration and some encouragement too.
Right. Right. Yes, exactly. There's invaluable.
Yeah, yeah. So let's talk about, I want to kind of go back to this business model and kind of gleaning some of the insights that you
Mhm.
have. So knowing a lot of the complexities within the traditional healthcare ecosystem, I think you see a lot of innovators that
Mhm.
go direct are going direct to consumer.
Mhm.
That I'm going to circumvent all of that healthcare ecosystem hoopla, and I'm just going to go direct to
The
consumer.
hoopla.
Just going to go directly to the consumer, and life is going to be so much easier.
Right.
Are what kind of conversations are you having with founders like that are kind of at that crossroad where they really could go direct to consumer, or going more of the B2B route?
Yeah. So my personal conversations with those folks is I'm not a direct to consumer expert. So
Yeah,
I
yeah.
would be really cautious about taking advice from me on that strategy,
Yeah, yeah,
because there are people much better prepared to have that.
sure.
But what some of the next part of the conversation needs to be, well, let's understand why. What do you think that opportunity could be? Why would you make that decision? Is it because you haven't gotten traction in the more traditional hoopla model, as you
Right,
kind of
right, yeah.
referenced? Um, is because you can't get in the door? Is it that folks are just not understanding your model, or whatever it would be?
Yeah,
So let's understand why you're making that decision, and have you been as efficient or effective as you could be on the traditional model? Um, if the answer there is yes, where we've exhausted it and we just aren't finding a way in, then let's look at it a little differently with, well, now how does your model need to change?
hmm,
Because on this side, the more traditional, you probably have things like, you could be a provider, payer contracts that you might have to look at. You may have different billing models, per member per month, or based on a success fee, or whatever it is.
hmm.
And now that model is going to change in a direct consumer. And again, I can't speak to what it
Yeah,
cost.
yeah.
Your acquisition cost in a direct consumer could be meaningfully different. Yeah, versus over here. So I think the conversation is really about, well, let's just understand the why.
Yeah.
And I have previously worked with a client that was trying to do both. We think we can do a medical side, and we can do a direct to consumer that's, a click down in terms of cost and complexity and that sort of thing.
Yeah.
And kind of back to your point earlier, that's a really, really broad strategy, and not unachievable, but it needs resources, both, people and connections and financial, to manage both of those.
Yeah, yeah. And I think you go back to what we were talking about earlier. It doesn't have to be either or, but it really should be either or to start
Yeah,
and
yeah,
gain some traction there. And then we can add that other layer into it. Otherwise, you're resourced so thin. I think you end up not being successful in any
yeah.
path.
Right, right.
Financial resources, but always also just time and attention.
Yeah, and I think we can get a mile wide and inch deep, and that's really challenging to run.
Yeah, yeah. So, what are some other things as we kind of just start to wrap up here? Because I
Mhm.
feel like we really could talk for days. I could just, you're just so easy to talk to and have such a wealth of knowledge. What are some other things that you want to make sure that you share with the community, both those, innovators that are corporate innovators, as well as those more early stage startups?
Yeah, I think a couple of things um, that some of I think that my clients have maybe been a little surprised about, especially those that are really early in, or maybe are entering healthcare for the first time,
Yeah.
is as we mentioned before, just not understanding the complexity and the interconnectedness, and how many times we say, well, because this, this one and this one and this one, and if you try to put it on a whiteboard somewhere, it just it starts to look like a mess. Um, but one of the other things is being able to speak the language,
Mm-hmm.
and spending time with people who know the language.
Yeah.
Because the health plan is going to talk about members. They're going to talk about their clients being the employers. They're going to talk about their government line of business and the different lines of business within the organization. If we're talking with providers, we're talking about patients, and we're talking about workflow, and we're talking about productivity, and we're talking about moving into value-based models. And I'm so overwhelmed with day to day. If we talk with health systems, it's a little different conversation. If we're talking about devices, it's a little different conversation. Or not maybe not conversation, the language is a bit different.
Yeah.
And so I think for founders that are moving across multiple parts of the healthcare ecosystem, spending a bit of time to just understand the things that are unique to each of those. And again, 80% of your message might be just fine, but 20% probably needs to be unique to that individual market. And that's an area that, especially for folks who are new to healthcare, is a challenge.
And that can make a difference. I don't think we realize how many acronyms we have because we're just so accustomed to speaking the language.
There's the military, and then there's healthcare in terms of the acronyms.
Right.
And for those who have kind of grown up in this and spent our whole careers here, the acronyms are easy. They just they roll off our tongue, and we get it. And there are times when we just say, well, because of this. But for someone who's new, that has an amazing idea and is passionate and could really disrupt and eliminate waste, or whatever the focus area is, a little time there, I think, could just go a long way.
Yeah. So I want to end on this question. What is your outlook for 2022, right? We've had a really rough couple of years in some ways because of all the challenges from the pandemic. We've also had a lot of disruption and a lot of opportunity. So what are you most excited about in 2022 when it comes to healthcare innovation?
So I'll answer first. I still think I still see that we're not out of a pandemic. We still have some meaningful things happening, and the providers that I speak with are exhausted for all sorts of reasons. And so we get that. So I think some innovation will still be tempered by the fact that we're not done yet.
No, we're not.
With the pandemic. So that I would just caveat to everything that there's still some work to go, especially for the providers that are listening. We hear you, and we thank you for all the work that you're doing.
Or the people that just have COVID right now.
Yes.
Amen.
Yeah, absolutely.
Yeah.
Where I'm very optimistic is that there's still amazing opportunity to disrupt, to change. And where I get excited is when I talk with people that are seeing it's not just a technology, but it's a technology and service. And I hear more folks talking about the importance of moving beyond engagement to activation into whatever it is. So I can get someone to download my app and use it, or to download and turn it on and register, but are they actually going to use it? So it's this activation. And I get excited when I see folks talking more and more, or hear folks talking more and more about the activation and the importance of behavior and behavior change in what we're doing. So that gets really gets me excited because I think there's amazing opportunity there.
That's awesome. I mean, that's the holy grail, right? We're really going to only transform healthcare until we have some behavioral change as a whole.
The other piece that gets me very excited is to hear more and more people talking about let's remove the disconnections between whatever my technology is, the health plan, the employer, and the provider. And again, that's the other holy grail, if there is one. If we can have two of them, that's the other one.
All sitting at the table at the same time. We can only dream, Pat. We can only dream.
But the conversation is different. It just seems as though we're recognizing that, and I think in the next couple of years, more and more employers that have really embraced the value of digital care will start to push and demand that these services start to connect even better than they do today. So that's really exciting because that conversation is on its way.
Yeah, I completely agree. I mean, I think that organizations are going to figure out that they have to play ball in order to maintain their presence, build a sustainable business. That continuing in the silo ecosystem will get will get rolled over by the
Right.
Amazon Care and the, the Apple Care and,
and by the consumers. I mean,
and
the
consumer.
consumers are, right. They're demanding that things be different, which
Right.
is great. That's just great. And again, that's where I come back to the founders looking at this environment and saying, we can help, we can do this differently, but we can't just come in without understanding that ecosystem.
Sure. Yeah, exactly. Well, thank you so much for sharing your wisdom and your experience with us today. I really appreciate it. How can folks get a hold of you if anybody wants to connect with you after the show?
Yeah, best way to find me is on LinkedIn, and all my contact information is there. I said earlier, I will always take the call. I love talking with folks. If someone just wants to pick up the phone, email me and say, can I bounce an idea off of you? 100%. Please feel free to do that.
Awesome. Thank you so much for joining me today.
Thank you so much. What a pleasure.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and attention. To get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who shared the show with friends and colleagues. See you on the next episode of Health Innovators.